Welcome to Dental Hub. Today's video is going to be about tooth anatomy. We're going to start off with a single tooth. The first part we're going to split out the tooth into three main sections. So the first part will be the crown, which is a portion of the tooth that's above the gum. So this is our gum line right here. And whatever you can see in your mouth, which is above the gum, this is the part that you brush. This is the part that tends to get cavity pretty often. This is basically what you see when you open your mouth. So that part is called the crown. Then right below the crown, by the gums, you have the neck, which is connection between the crown and the root. The root is a portion that is underneath. So it's right here. It's underneath your gums. It's embedded in your bone. Okay, so this will be your root. Right alongside. Some teeth have one root, some have two, some have three, some tend to have more, depending on, but it's typically either one, two, or three roots. Okay, and then we're going to break it down into smaller sections. So we have our enamel. So the outer coating of your teeth is called the enamel. This is what gives it the white color. This is where it gets the staining. And with this, if cavities are to develop, they start developing in the enamel because it is the more outer part of your tooth. Then we have our dentin, which is this little yellowish shade over here. This is it's a sensitive area, and if a cavity is to form within that area, you tend to feel pain pretty quickly. It tends to deteriorate much faster than your enamel. It's not as strong as your enamel is, so this is why it's on the inside. The enamel is there to protect it. Next, we have our nerve. Now, this is a part that feels everything. It feels pain. It will feel coldness, sensitivity to coldness, sensitivity to hot. So if you do have a cavity and it's pretty close to your nerve, this is the portion that will feel everything. And if a cavity do extend to your nerve, you need a root canal, but we'll talk about root canals later down. Then you have your cementum. Now what this is the part of your tooth that is below your gums that extends all the way around your gums. This attaches your gums, your bone to your tooth. So it's cementum, comes from the word cement. It's basically there to hold your tooth in place into the bone. Then we have our gingiva, which is a fancier way of saying gums. So this is that pinkness right around here. And if you open your mouth as well, you can see this in there. So that pinkness that you see around your bone, you're not going to see your bone in your mouth, but you will see this pink tissue in your bone, in your mouth. Then we have our bone itself. This is part of our jawbone, which is what our teeth are embedded in. Then we have our nerve canals. So nerve canals run down the roots into a nerve channel on the bottom over here. This connects each tooth to each other. So this one will keep running, and then there'll be another tooth here with a similar setup as this one, and then this will go the other direction. Then we have at the very tip of our tooth, inside our bone, the very, very end of our roots, so it's here and this one here, these are called our apex, which is just the end of the root. So there you have it. This is the basic anatomy of a single tooth. These labels can be transferred from tooth to tooth. Each tooth have a different shape, a different setup, but overall they're almost pretty much the same thing. Like I said earlier, one tooth might have one root, one might have two roots, some might have three, that all varies, but all these labels are transferable from tooth to tooth.